Senator from Iowa.
I ask that the calling of the quorum be suspended.
Without objection. Senator is recognized.
Mr. President, I'm committed to lowering health care costs, expanding access to high-quality care, and supporting research and innovation. The healthcare system in the United States needs more reform and accountability. However, we shouldn't ruin it by turning it into a government-run healthcare system. Whether you want to call that government-run healthcare system Medicare for all, or single-payer, or even socialized medicine. A government-run healthcare system is one-size-fits-all approach. It results in longer wait times, delayed care, and do-it-yourself health care because you cannot access a doctor. In February, the Wall Street Journal highlighted the failure of the United Kingdom's National Health Service, NHS for short. They wrote, quote, "Now the state-funded service is falling apart. People who suffer heart attacks or strokes wait more than 1.5 hours on average for an ambulance. Hospitals are so full that they're turning patients away. A record 7 1/10 million people in England, more than 1 in 10, are stuck on waiting lists for non-emergency hospital treatment like hip replacements," end of quote. But I want to quote from the article of the Wall Street Journal, another one. Quote, "Delays in treating people are causing the premature deaths of 300 to 500 people a week. 1 in 5 British people were awaiting for a medical appointment or treatment by NHS in December," end of quotes. If you didn't find that article about the United Kingdom alarming, in May, British Columbia announced that they're sending cancer patients to Bellingham, Washington, in the United States for treatment. A Canadian news outlet wrote this, that Health Minister Adrian Dix announced, quote, that eligible breast and prostate cancer patients will be sent to 1 or 2 clinics in Bellingham for radiation treatment. The unprecedented move to send thousands of British Columbia patients to the United States over the next 2 years is an attempt to address the backlog in British Columbia, which has one of the longest waits for radiation treatment in Canada, end of quote. Canada is taking this action because its cancer patients face unacceptable waiting times, currently only 82 and 9/10% of the British cancer patients who require radiation start treatment within 28 days. That means that 17% of cancer patients are waiting at least a month or longer to start cancer treatment. Canada's single-payer health care problems aren't found in just one province. In January, Wall Street Journal reported that Ontario is turning to private health care options to fix the growing problem with its single-payer funded health care system. Canada's most populous province is allowing more patients to go to private treatment centers for cataracts and joint replacement surgeries and for services such as MRIs and CT scans. The Wall Street Journal writes, quote, "The median wait time in Canada last year between referral and treatment was 27 4/10 weeks, the longest on record compared to 9 3/10 weeks in 1993. Ontario reported the shortest wait times of 20 and 3/10 weeks, while the eastern province of Prince Edward Island reported the longest at 64 and 7/10 weeks. And finally, back to Great Britain, the YouGov poll recently found that Britons are, quote, pulling their teeth out with pliers, end of quote, because they can't access the National Health Care Service dentist. The poll found 10% of the respondents had attempted to do-it-yourself dentistry. Mr. President, I'm committed to improving the healthcare system. I'm working to lower cost of prescription drugs, maintain access to rural health care, ensure our nation's seniors can have high-quality, affordable hearing aids, address high maternal mortality rates, and lastly, improve the healthcare delivery systems for kids with complex medical needs. And that's just to name a few. However, a government-run healthcare system is not the answer. British and Canadian healthcare systems are plagued by longer and longer wait times and delayed care. These government-run healthcare systems are paying for patients to get care in the United States, not resorting to DIY healthcare. Mr. President, this body needs to be reminded how government-run healthcare systems are broken and do not work. In closing, I ask unanimous consent to put articles that I referred to in my remarks into the record.
Without objection, so
I
ordered.
yield.